is for private healthcare centers and their D is for government healthcare centers. Thank you.
Hello friends, my name is Aniket Yadav and today I will tell you some lines about that how government hospitals are different from the private hospitals. Government hospitals are usually cheap and it's affordable for the poor people.
My name is Fatma Sheikh and I'm here to support the private hospital side. So my first point is a hospital is a place where the patients and his or her relatives feel safe and secure. Now my first point is about privacy. Privacy matters. If you can see in India, privacy beds, now you can see around more than 3.5 beds are for the government hospitals and 2.5 beds are for the private hospitals. But still the government hospitals are not affording more beds and giving on one bed, they are like 3 to 5 people sleeping on that bed. And on private hospitals, they get to choose their own bed and they are, they have their own luxuries.
Myself, Mr. Deva. Now I am going to counter type the private hospital from the government. As please, the point which we said is the perfect point, but we are more affordable and we are more flexible and we don't need and we accept every type of insurance that every person, every poor person or village person and we provide to them can come here and be treated for their treatment. And we have much higher number of beds than private, and we can accommodate more patients at a time, and we don't have to. And our doctors are always at 24/7 available for the patients.
As he said, they are more affordable, but one more thing, that in private hospitals we have better facilities and amenities. We have personal privacy and quiet rooms which help the patient to recover faster. So there's a faster recovery. And the reason these are expensive are there are more new style of treatments and new equipments. The new equipments help to recover faster. So I would at the end say that private hospitals are they are not affordable, little bit expensive because of the new amenities and facilities.
More important, I'm going to counter here what you said was correct, but more importantly, public hospitals aren't lenient in terms of services. There are always 24/7 doctors in the hospital to look into emergency cases, and also the routine visits to admitted patients is regular even few times a day.
Yes, he said correct that the government hospitals aren't really lenient, but there are so many people in government hospitals that the infection can go to one people to another people, and that can cause more infection. So yes, government hospitals are trying, but in private hospitals there are different rooms. There is no two patients are sitting in one room, and doctors are highly educated.
She is correct, but while private hospitals have more facilities, but they are very expensive and not suitable for many people. Inequality is also seen in private hospitals. Private hospitals and their lack of doctors enables them to treat many patients at a given time.
Speedy treatment is there in private hospitals. Due to volume of cases in the government hospitals, it takes more time to deal with the case.
Of the total 2904 are the public hospitals and the 1060 are the private, so public hospitals are more available.
Ma'am,
Now I want to counter that, yeah, he said it correct that they are giving that the doctors are available 24/7 and about that to crowded areas. But if you see also that in the government areas there is a lot of crowded places. If you can even see like half of the hospital is filled with the lines of the people who are waiting and not even the patients. And in the private hospitals there is less, and which affects the patients and medical conditions as well. So environment also matters for this.
I want to counter her point. She said correct, but looking at services, a well-maintained public hospital is equipped with the latest gadgets and medical equipment to provide best services to the patients. Hospitals ICU are equipped and extra care is taken to give the best treatment to our patients and care to sensitive patients.
Private hospitals have less crowds, better food and beverages. Private hospitals have professional staff, much more experienced doctors.
Private hospitals are funded by individual or group of people, while government hospitals are funded by the state.
Like the private hospitals have better equipments, they have better techniques that help the patient to recover fast. And because of the highly educated doctors, they maintain their position. They have a position in which government hospitals uses many equipments, but private hospitals have many more techniques and it is very much organized.
I would like to counter the point that they are usually more affordable than private facilities. They also have a much higher number of beds, so they can accommodate more patients at a time.
Private hospitals have more educated doctors and they have doctors for each and every disease, which are also available in every time. Thank you.
The government health care. A live example that government healthcare are providing more facilities to the poor and provide more facilities to the poorest of the poor. The live example is the COVID. In the COVID pandemic, the government hospital are providing the vaccine that are given by the government for free, while the private hospitals were giving it and were costing it for the price until the Prime Minister of India, Mr. Narendra Modi ji, told that the vaccine should be free of the cost, no matter who it is.
Even if you get the vaccine for free in the government hospitals, you will because it is given free, there is so much crowd in the government hospitals. So even if it is paid in private, less people come. So that will give more chances for people to be vaccinated.
The private there's a lot of crowd in the government hospital because the private hospitals are not able to the poor people can't go to the private healthcare facilities because they are charging so much cost that they are not even able to pay. So the person who doesn't even earn a three digit salary are not able to go to private hospital. That's why they're coming to the government hospitals, and that's why they're crowded as always.
Private hospitals are generally in the urban areas, while the government hospitals are also present in villages that help the poor.
She said that right, that the private hospitals are in the cities areas and the government hospitals are in the villages and that way. But ma'am, the most important point is that the government hospitals are not having proper hygiene and care. The most important point is that private hospitals are having hygiene, good healthcare, comfortable zone, and you can even choose your own room there according to your salary or whatever you have. And in the government hospital, they are not even doing anything with the hygiene.
We know that we don't have good hygiene, but they have a lack of staff, which means very bad service, and also employers are paid more in the government office.
We have advanced technology in management of disease and well qualified doctors and nurses.
Of the total, 2,904 public hospitals and 1,060 are private. So public hospitals are more easily available.
there is an easy availability of support staff, which is beneficial for patients having less or no attendant with them or themselves, and it is very beneficial in the time of emergencies because they have a quick action towards the patient who needs a lot of support at the time.
Private hospitals are funded by an individual, but the government hospitals are funded by the government or municipality. So that they are always and because the private hospitals are funded individually, the person who's funding can look after the private hospital alone, but the government can look after all the hospitals, government hospitals that are all across the India.
Private hospitals are more speed and fast services. If the patient is in need for something, the nurse comes so far that it is easy and capable. Thank you.
While private hospitals have more facilities, but they are very expensive and are not suitable to many people.
Ma'am, as government hospitals have more crowds, and that is why there are in private hospitals there are less crowds, and for that short waiting times are also provided there. But in government hospitals there are long waiting times because of more crowds.
But in the private hospitals, the poor people are not able to pay the fees because it's very expensive.
Yes, private hospitals are very expensive, but still there are more facilities for the surgeries.
Yes, as she said that the private hospitals are expensive, but there is expensive, but they use latest technology and no delay in administration procedures, and the treatment starts as early as possible, and there is easy availability of medicines, of tools, etc. So as private hospitals give more facilities, so it also charges more.
Private hospitals have more abilities and facilities, but because they are funded by an individual, but while the government hospital does not have too much facilities because it is funded by the state, and then state cannot look out after many hospitals.
Private case means you have a separate space of your own when the least disturbance.
Yes, private hospital is expensive for the vaccination rate, and it is also safe because in government hospitals everybody goes and it is more dangerous to get a virus during the pandemic.
As she said, private hospitals are more expensive, but the treatment is so reliable, so that we can rely on them and they are worth.
As they said that when there was the time of vaccination, government hospitals were providing free vaccination. But at the time they didn't see the amount of cleanliness and hygiene. But at the private hospitals we have better cleanliness and hygiene even while putting the vaccines and operating the patients.
Yes, private hospitals are very expensive, which a common man can't afford it. But nowadays there is a lot of medical and policy insurance which people think about a lot. And the private hospital covers 70% of the hospital, and the public hospital whereas cover the only 30% of the hospitals. And they also cover the 80% of the OPD, which is our department.
So in conclusion, I can